Michelle Melville-Kashan. I'm the Community Development Coordinator here at Sexual Health Alliance, and we have a really exciting event coming up in January. This girl is on fire, Menopause Online Sexceptional Weekend, which will be January 25th and 26th, 2025. This is an online event, and it's going to be really great. I have one of our presenters here with us today, Dr. Lauren Streicher. Dr. Lauren Streicher is a clinical professor of obstetrics and gynecology at Northwestern University's Feinberg School of Medicine and is the founding medical director of the Northwestern Medicine Center for Sexual Medicine and Menopause. She is a certified menopause practitioner of the Menopause Society, serves on the editorial board of the Journal of Menopause, is a senior research fellow at the Kinsey Institute in Indiana University. Her essays, podcasts, and educational guides can be found on Substack, and I will put that link below. Welcome, Dr. Streicher.
Well, thank you. I'm excited to participate in this weekend.
Yes, we're so happy to have you. Can you tell us a little bit about what you're going to be talking about during this event?
Well, I'm going to be speaking on two key topics. The first one is orgasm. And while we don't think about the problems that a postmenopause woman might have having an orgasm, it's actually an enormous problem. And in fact, about 51% of women have difficulty with orgasm. Why? Because of not just the hormonal changes that occur, but also things that occur because of aging or maybe other medical problems. And you need to have healthy blood vessels and healthy nerve endings in order to have a clitoris that responds. So I am solution oriented, and this topic is going to be about why it happens and what we can do to wake up those clitoral nerve endings. And sometimes it's just as simple as doing something to increase the blood flow, like putting a little topical estrogen directly on the clitoris. The second topic I'm going to be talking about is something that people really do think about more in postmenopause women, and that's pain with penetrative sex, whether it's sex with a penis or a toy. It's just either isn't going to go in there at all, or it's so painful that it's a nightmare. And while everyone always assumes that this is because of hormonal changes and vaginal dryness, there are other things that can cause painful penetration as well. So I'm going to be talking about all of the things that might get in the way of having pleasurable penetration, and then give, again, solution-oriented tips that can be used to help women get past that hump and have intercourse be once again pleasurable instead of painful. And honestly, sometimes it's as easy as just knowing the right lubricant to recommend.
Yeah. This is going to be such great information. I am so excited for our audience to learn from you and to take this back to the people they work with. If you want to learn more about this weekend event, you can go to our website at sexualhealthalliance.com, and I will also put the link in the description below. Thank you, Dr. Streicher, for being with us today.
I appreciate being part of this conference. I'm looking forward to it, and I can't wait to hear everyone's questions because that's always the most interesting part for me.
Yes, I love that. We have a really active community and they ask really great questions. So it's going to be wonderful.
Well, my challenge always is ask me a question I haven't gotten before. It hasn't happened yet. And I talk to a lot of therapists.
I love that.